I think the most important awareness for women is the knowledge of her normal anatomy, because many women don't know their normal anatomy. And so in order to understand what is abnormal, what is the pathology, or what is the damage, you have to know the normal anatomy. And sometimes also physicians don't know very well normal anatomy. And so I think that the awareness that, about the possibility to improve the aspect is today a reality, is true, is possible. But I think that we have also to consider the function, not only the cosmetic aspect. So women are trying to achieve a good result on their appearance, but also for their function, because they may have sexual dysfunction deriving from the damage, for example, for the liver's damage, or secondary to pathologies such as lichen sclerosus, for example. So they have to know the possibility to change the aspect and so on the function. Obviously, we all know that minora labiaplasty is the most performed type of surgery, because all women think to have abnormal labia minora, no? And they are trying to achieve a younger aspect, no? An aspect like they were younger. But I perform in this year. I'm performing the so-called vaginal rejuvenation, the vaginoplasty, for example. It's a surgical treatment in order to reduce the caliber of the vagina. Some women ask it because they think that the lack of friction during sexual intercourse is important, but you have to consider that they ask it not only to enhance their own sexual function, but also the sexual desire of her partner. On the other hand, I perform also another kind of surgery, that is the surgery in order to enlarge the introitus of the vagina, because some pathologies, like lichen sclerosus, may cause the straightening of the introitus. And so I think that if we aim to improve the quality of life of all women, we have to check every time the sexual function, the well-being, and so on. Surely, at this moment, there is an incredible development of new techniques, or modified surgical technique, all surgical technique modified, new technologies like laser, radiofrequency, and so on. There are also some old techniques like vagina steaming that are now fashionable, for example. But I think that the most important changing in this time in aesthetic gynecology is the interest by gynecologists, because until now only plastic surgeons performed this kind of therapy, or aesthetic physicians. The interest of gynecologists is fundamental because I'm a neurogynecologist and I work on women. My patients are only women. The interest of gynecologists is important in order to achieve what I said before, both the aesthetic and functional results of our treatment.